for the work you do at Carmel West. This hospital is so important, this whole system, to our great city, so thank you so much. Christine, thank you for the work you do training nurses. Appreciate that. Christine came to our annual President's Conference. We do a program every year in Washington for the last 7 or 8 years, 2-year, 4-year private public colleges. And they talk to each other and work out ideas and best practices. We have 40 or 50 college presidents come. The state is perhaps the richest in the country in terms of the sort of the panoply of 2-year and 4-year private and public colleges. And so I wish the state would fund them better, but other than that part. So, but thank you, Christy, for being here.
Keep working on that.
I'll be joined today by Lois Fankhauser, who will talk about her experience with, I understand, some humor, but I got to quit saying that because we're raising the bar on this joke. I learned a lot. Some of you know Al Franken is a senator from Ohio or from Minnesota, and I saw him the other day in Cleveland, but he once said, I said something I thought was funny to him once, and he said, you all know who he is, he was a comedian, and he said, Sherrod, just because I'm a comedian doesn't make you funny. Or something like that. As Dr. Schreck said, the cost of prescription drugs is increasingly a problem again in this country. What we're able to do with the Affordable Care Act 5 years ago to begin to eliminate the sort of idiotic, in some sense, donut hole that was built a decade before, where seniors fall into this donut hole after spending $2,000 on their drugs, continue to pay their premium and don't get out of it until they spend $5,000. So during those months, they're actually paying twice for their drugs in some sense. The fact that we've closed that by about 70% so far, it will be eliminated. But unfortunately, while we've done that, a number of drug companies have found it possible and desirable from their bottom line perspective to raise the price of prescription drugs dramatically. And it's not really an issue of supply and demand in far too many cases, and I'll mention a couple of those. Companies like Valiant and Turing and Rodellis have bought the rights to long-time prescription drugs or generics, raised the price dramatically 2 times, 3 times, 5 times, even 10 times in some cases, and then sold those drugs when people have little choice because it's the only drug in the market. It's not a question of they're recouping research and development dollars when the drug was developed half a generation ago or even a decade ago. It's just, it really is price gouging. We saw it 4 years ago for the first time, that I noticed at least, in a progesterone drug. It was an injection that women who were at risk of low birth weight babies, of premature delivery, women took a drug compound of progesterone, it was called P17, took that month, would have a shot every week for the 20 weeks before delivery. That injection was costing only $10 or $15 an injection. They took 20 of them. A company out of St. Louis did a clinical trial, bought the rights to that, did a clinical trial, raised the price literally from $10 or $15 to $1,500 an injection, just putting out of reach. Insurance companies, many insurance companies had denied them, but putting out of reach what the women getting those drugs to save their babies' lives, or to save their babies' at least normal development. All those kinds of things were happening. Now we're seeing, and let me give you the example more recently, Valiant acquired Salix Pharmaceuticals. It raised the price of its diabetes drug, Glumetza, right pronunciation, Dr. Sherrod, Glumetza, by 800%. Glumetza has been, for years, been the first drug a physician prescribes to an individual with type 2 diabetes. It isn't new and improved in any sense of the word. It's the same drug, but it costs 800% of what it cost before. It's not right. Federal prosecutors are investigating Valiant over its egregious actions, but it's not necessarily illegal what they did, and we hope there's some way to stop it. A couple of these companies that have done this have decided that maybe they ought to back off. They've reduced the price some, but the price increase has still been much higher than it started at the beginning. One of the answers to this is pretty simple. It's allowing Medicare to do what the Veterans Administration does and what the Canadian government does, and that is to allow Medicare to negotiate the price of drugs directly with the drug company. So the reason it works at the VA, there are millions of veterans And we at the VA negotiates on behalf of those millions of veterans a good price with the drug company, and brings the price down sometimes 40, 50%. We can do the same thing with Medicare. The reason we don't is because of pharmaceutical company lobbying. They lobbied 15 years ago on the drug benefit. They lobbied during the Affordable Care Act. They convinced too many members of Congress. They convinced almost every Republican and far too many Democrats to do their bidding and stop us from doing this legislation. So we're reintroducing a bill. It's called the Medicare Prescription Drug Savings and Choice Act. It's very simple. It allows the government to negotiate prices on behalf of senior citizens, bringing the Medicare price dramatically down. Once we're able to do that, if we can, you will see private insurers do much of the same. They'll follow that price as Medicare often does now, and we'll see prices more competitive everywhere. The purpose of life savings drugs is to do just that, to save lives, not to line the pockets of big pharma, not to line the pockets of these investors that have bought into these drug companies. We pass this legislation, it will mean that health care at Mount Carmel West and anywhere in this country will be more affordable, that seniors especially, but others too, can get prescription drugs at reasonable price, the way that we've tried to do for many years. I honor now to bring forth Lois Fankhauser, who lives in east side of Columbus, been a resident